Hey YouTube, what's up? I know I'm sitting in a different place today. It's because it's really brutally hot outside and I have my air conditioning going on over there, and in my bedroom I have the air conditioning going on, so there might be a little issue with the sound, but hopefully it's okay. So yeah, I want to talk about I don't know, I had this kind of funny moment, but before I share the funny moment, I have to, backstory, that I'm not really accepting of myself in terms of like my trans status. I just, I want to be able to have surgery and kind of walk away from being trans, but that's not going to happen. So I have to learn to accept being trans and that I'm still whole as a man, even though I'm trans, and that is tough. It really is. So I have this image in my mind that maybe someday I'll have this great epiphany of acceptance and just be like, wow, I totally get it now. Wow, I love myself for all, blah, 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 blah. And I was thinking about the Grinch that stole Christmas. I'm sure you guys are familiar with that. And after he steals all the stuff for Christmas and he's standing on the top of the mountain with his dog Max, and he hears the rising over the hilltop, the song of, the Who's down in Whoville singing, and he's like, how is it possible? It came without packages, it came without ribbon, it came without, the Who ham and all this stuff, and he didn't stop Christmas from coming, and then he had this realization that maybe Christmas means something a little bit more. And I was like, that would be kind of cool if I had that kind of epiphany with the trans stuff, specifically like the lower surgery, the genital stuff, like, something about it comes without testicles, it comes without penis, it comes without sperm, like I'll list all these things, and that maybe being male means something a little bit more, kind of thing. I don't know. I thought it was, I kind of went with that train of thought, and I thought it was really funny. And instead of, if I'm the Grinch, my heart is 2 sizes too small, it'd be, my penis is 2 sizes too small, kind of thing. And yeah, I don't know. I was just being stupid, but I think if any of you guys are really creative out there, I think you should do like a spoof on that and do it like totally trans related. That'd be cool. So where I'm at with my lower surgery is that I think I realized that long-term wise I'm going to want the phalloplasty. I just don't see myself being completely satisfied with the meta. But I don't think I can wait that long for the phallo. I think for my own just quality of life that I need to have something done sooner. So I was thinking that I would next year perhaps get the meta, and that would at least allow me to feel comfortable enough to move on with my life and pursue other things, but still save up on a much slower time frame for the phallo. That's where I'm at. I don't know. Part of me doesn't want to waste that money on the meta, you know what I'm saying? But I just can't imagine working 12-hour days for like 3 years or something like that. I can do it for like another, I don't know. But I would have the meta with either Dr. Miro in Belgrade or Dr. Crane in San Francisco. So I'm going to go to see Dr. Brownstein in January to do a revision on my chest, just to get some dog ears. And at the same time, while I'm up there, I'll have a consultation with Dr. Crane and talk to him a little more. I've already talked to him on the phone, and he seems cool, but I haven't seen any pictures of his work, mostly because he said that, he was, not the, what's it called? Well, he was one of the surgeons, but he wasn't like the main surgeon, or the person that gets credit for the surgery was like, Miro or the other dudes. But he said he did the majority of the work, so he wants to get, I guess, the authorization to show the photos of the work that he has done under the guidance of Miro, kind of thing. So I'm very excited about that. I like the idea of not having to go out of the country for surgery, just because the last 2 surgeries that I've had like weird things where, well, years ago when I had my tonsillectomy, I kind of woke up in the middle of this procedure, and then with my top surgery, I wasn't totally unconscious when I was intubated, and that was kind of horrible. So, and because there's a language barrier, I feel like if there's something weird that does happen, I want to be able to really be able to communicate, stuff like that. And I don't know who the hell I would take overseas with me anyway, whereas I know people in the Bay Area, and while I don't want to base something as vital as, my penis stuff around like who will be with me, but it is realistic. Like, I am not going to fly to Serbia by myself, and yeah, so that's where I'm at, and that's it.